Thanks for tuning in to Season 4 of Strange, Rare, and Peculiar Homeopathy Podcast, where homeopathy lives, breathes, and evolves with Denise Strages and Alistair Gray. We'll be exploring modern practice, research, and philosophy, from Hahnemann's radical insights to today's breakthroughs and discoveries. Get ready for homeopathy woes, feedback from pros, and the more you knows.
Evening and all the things. If you listen to this podcast regularly, you will notice that it's not Alistair Gray who's doing the introduction of his good morning, good afternoon, good evening. And it's because I, Denise Strages, have the special privilege of interviewing a guest today. We've got Dr. Nancy O'Hara with us, and she is to my mind, one of the leading voices around PANS and PANDAS. And so, since this is something that homeopaths are dealing with more than ever now, I'm really grateful that we've got Dr. O'Hara to talk with us today about PANS and PANDAS. So, thanks for taking the time to meet.
Yeah, no problem. And thank you for having me. And as an MD, I have to say that I have learned so much from my naturopathic and homeopathic colleagues, and really find homeopathy to be one of the adjuncts or treatments for our kids with PANS PANDAS. So I dabble, do not treat. But did take a course to understand it better, and I'm so thrilled to just offer to families that there are many ways to get at this disease.
Yeah, when you and I first spoke, I think it has to be at least 6 months ago now. It was quite a while ago. I was really, first of all, I was so just impressed with the way that you hit the ground running and said, there's a giant problem and I need to sort it out. Thanks for that, because this is one of the scariest things I think that I've really seen in my, decades of practice. But the other thing was, we homeopaths always love when someone is homeopathy friendly. So thank you for that. Would you talk to everybody about your journey and how you found yourself in this, in
Yeah.
this specialty?
Yeah, so I'm a little bit verbose, so bear with me, everybody. But my career plan started very early on. I was either going to be a teacher or a doctor. Both of my parents are doctors, physicians, and I taught children with autism right out of college. And truthfully, I was a really lousy teacher. So I always say, and it's very truthful, I took the easier road and went to medical school. But because I had taught children with autism in my typical medical practice, I had a lot of children with autism in the practice. And it was one in particular who at the time was 4.5, non-speaking, and had tremendous allergies, asthma, all of that, and improved with going to dairy free. And I thought it was a bunch of hooey. But the mom came to me and she said, "This is real." I took him off dairy. He started talking. I put him back on dairy. He stopped. I did it 3 or 4 times. And she then found my mentor, Dr. Sidney Baker, who is the grandfather of functional medicine. And sort of, one of his mentors always said to him, "Sidney, have we done enough for this child?" And that has always been something I've held true. So after I met Sid, so I went to Sid as a patient, actually, because I was going through 4 years of infertility and nothing in the Western medical world was helping me. I went to Sid, was pregnant 6 months later, and started my functional medicine practice for children with special needs, autism, neurodevelopmental issues. And then fast forward 9 years, and my own very neurotypical son, after getting bit by a Borrelia positive tick and getting strep throat, and a viral infection all in the same week, devolved into seizure-like tics. And that's when I really delved in with 2 feet to PANS and PANDAS. And that was about 17 years ago now, 18 years ago. And that has become my passion. And my COVID baby, which was a lot harder to produce than my other baby, was my book, Demystifying PANS Pandas. And since then, I've developed a mentorship program, a membership program, a podcast myself, just to get the word out, because I think this is a very misunderstood, misrepresented, and challenging disease that all of us, parents, practitioners, and particularly conventional medical people, need to better understand and even admit that it exists.
Well, that's the thing, the admitting that it exists. I was doing a supervision for a homeopath who reached out to me and said, I've got a case of this kid who was doing fine, had some behavior issues, whatever, and then overnight developed severe OCD, tics, blah, blah, blah. They took him to a major teaching hospital, pediatric institution, and nobody acknowledged this is only maybe 2 years ago.
Yeah.
Um, and the mom who's up all night freaking out because of what's happening to her child is Googling, finds pans and pandas, takes it to the doctors who said, no, that's impossible. And as parents, when something happens to to our kids, we're going to be the best researchers ever. Um, what do you think about this spike? Why are we seeing such a spike? Do you put the number still at around 1 in 200 kids?
In my practice, it's 1 and 2.
Right.
But I think we're more down to 1 in 150.
Okay.
I think there are a few things. So first, I want to just one thing that Sid always taught me. It's a slide he always used in his talks, which is follow those that seek the truth,
Mhm.
flee from those who have found it. And I use that in Pans Pandas all the time.
Oh,
So if somebody says it doesn't exist, I don't believe you, run the other way. That person, you're not going to convince them necessarily. Come back again when your child is all better and show them,
yeah.
but find a practitioner that really understands. And there are a lot of them out there, and I'm happy to give advice on that. But with regard to Pans and Pandas, I think there are two things. One, I think there is use of those words, that those acronyms, when
Mhm.
it shouldn't be.
Mm.
And in talking to Sue Sweeto, who is the grandmother of Pans Pandas, she wishes it was still called autoimmune encephalitis of the basal ganglia
Yeah.
associated with streptococcal infections, because that is more accurate and less kitschy. But we should really only be using that moniker, that acronym, in pediatrics, because the P is pediatrics. But
Right.
absolutely, we know that adults can get this, especially with tick-borne disease, mold, or if they were misdiagnosed or undertreated or mistreated as a child.
Mhm.
And we know that there are more subacute presentations, either because the initial presentation that was acute was very early on and they missed it in life, or again, because it's vector-borne diseases or mold. But we should keep those two things in mind if we're going to use these terms.
Right.
PANS pandas. It needs to be abrupt onset at some point and it needs to be pediatric. Otherwise, let's call it autoimmune encephalitis of the basal ganglia. And in fact, when I write letters for people, when I talk to other doctors who don't understand it, those are the words I use because that's an accurate representation of what it is. But
Right.
I think, both because, Sue coined the phrase pandas and people have taken advantage of the kitschy name of that, the fact that it's a clinical diagnosis and there really are no tests that can prove it or disprove it, really. That those things, and then my hat that it was developed by a woman who wouldn't name it the Sweeto disease. I think some of our very conventionally trained male gender cohorts may hold that against the disease. Anyway.
I think it's interesting in reading her papers, those two seminal papers, the second one about PANS in removing the reliance on group A strep for the diagnosis. And then in that paper, so anyone who hasn't read the papers, if you just go on Google Scholar, Sweeto et al., the second paper was in 20, was that 20?
2012.
2012 was the second one. And so it was really interesting because looking at it through the lens of the autoimmune profile and saying we need to see this, I'm going to say condition or this set of symptoms and differentiate it from other pediatric autoimmune diseases. And there were a few that I wasn't really familiar with. And it's funny because my practice is on complex autoimmunity, and in the past couple of years, it's just exponentially.
Oh, I want to talk about that too. Sorry,
Yeah.
I missed that part of it. Yeah.
Yeah. And so can you talk a little bit about that, about when, they brought together the 400 cases and said, look,
Yeah.
we've got to identify what's really happening here and remove just the group A strep from the
Right.
causation.
Right. So, first, to finish addressing your previous question, one of the things that's changed is COVID, and COVID reactivated
Mm-hmm.
a lot of underlying dormant vector-borne, tick-borne, mold or yeast-borne diseases. So that's one of the things that changed, in addition to the reliance on screens that we've all developed and the isolationism that has happened that's really increased everybody's baseline anxiety, in my opinion.
Yeah.
But basically, PANDAS was very controversial when 30 clinicians, researchers got together in 2011 to develop what they call this white paper
Mm-hmm.
to try to expand the umbrella of the diagnosis and include things like Lyme or vector-borne diseases, mycoplasma, viruses, anesthesia, toxicants like pesticides, etc. Because all of those can cause abrupt onset changes and
Right.
inflammation in the brain. But in broadening it so much, there was a lot of disagreement even at that meeting. In fact, three of the 30 called it, rather than calling it PANS, called it CANS and wrote a separate paper.
Oh, I didn't know about that.
Yeah. And
Well,
so it didn't decrease. It in fact increased the controversy because, tick-borne diseases, vector-borne diseases, Lyme, Borrelia, Bartonella, Babesia are
yeah.
so underdiagnosed, misdiagnosed, mistreated, undertreated, that is almost a whole separate circle that conventional doctors don't even want to touch, and certainly don't understand the chronicity, the chronic illness that many of our patients can have. So that's number one, and number two, there's a misunderstanding of mold disease, for example, or
Right.
of these other toxicants, and we live in such a toxic world. Truthfully, if we don't put the abrupt and the P in, everybody in the world will have this right
Right.
now, like,
Yeah, yeah, yeah.
and that's what's made it hard because I think it's jaded a lot of the conventional doctors because we've tried to almost have too many people under the umbrella. And
Mm,
so they're throwing the baby out with the bathwater,
sure.
sort of thing.
That is so interesting. Huh. What do you see about the sort of the autoimmune component combined with, because we homeopaths have a very particular way of understanding what we would call susceptibility and then also chronic diseases as a part of the paradigm of homeopathy. It sort of explains it, but I'm always curious to hear it from other
Yeah.
practitioner points of view. So what about, how do you see sort of pediatric autoimmunity in
Right.
this, through this lens?
Absolutely. And one of the phrases that I think I said to you before and that I always use is genetics loads the gun, environment pulls the
Right.
trigger.
Yep.
And so in these kids that get it, there has to be a genetic susceptibility.
Yep.
And from a homeopathic perspective, which I want to get into more, I think you and I are more alike than we are different in that I'm always looking at root cause medicine. So even though I'm not a homeopath, I so appreciate that looking at the underlying susceptibilities and the root of the disease as opposed to just the surface stuff that I think the way we're trained in conventional medicine doesn't get at. But this is an autoimmune disease. This is not an infectious disease. This is an infection triggered or metabolically triggered if we talk about a pesticide or anesthesia or something, but there's a trigger that
Yeah.
in those that are susceptible causes the antibodies or the immune system reaction that then crosses the blood-brain barrier, those proteins or antibodies, and those cause the inflammation in the basal ganglia, that part of the brain, then causes the symptoms that we see. So the amygdala, the hypothalamus, the caudate, the putamen, that
Mm.
whole basal ganglia area gets
Right.
inflamed. And that inflammation from the immune system reaction, from the autoimmune reaction, is what causes the symptoms. And
Mm.
so in conventional medicine, if we just throw an antibiotic and a little bit of ibuprofen on, we are not treating the whole child and
Right.
everything else that may be going on to both increase their susceptibility and increase their symptoms.
Well, and it's like a tail chaser because a
Yeah.
lot of times the antibiotics will give symptomatic relief for a short period of time. Next thing you know, you've got a kid who's on a prophylactic course of antibiotics, and then when that tanks, then the wheels fall off the bus, right?
Yeah.
So, but they're
Or they're not looking at what else is in the background. That
right.
there's tick-borne disease in the background. You throw one antibiotic in, yeah, you may be killing it partially, but you're also killing the gut and you're causing more immunodeficiency. And the same thing with mold, that's a fungal. You put antibiotics on, that's going to get worse. So there's a misunderstanding of that grass that everything else is growing on when you just throw one thing in to try to treat the complex nature of this whole disease.
It's so interesting because one of the ways, and I'm going to see if I can say this in a it takes a long runway to actually make the point I want to make. So I'm going to try to do it in a short thing. I'm actually presenting at a conference on this coming up in a couple of weeks. And it's one of the things that I've done is I've traced Sydenham's Korea back to, the fourth century and looked at the different permutations of it over time. And then look at how prophylactic antibiotic use that came on board in 1940 when penicillin became standard of care for group A strep to, in effect, ward off rheumatic fever and subsequent Sydenham's Korea, they thought, oh, great, Coke gets a Nobel Prize, everybody happy. But now we see 80 years after that, it's almost as if the acute manifestation, we've jumped right over it. And
Yep.
so it's like, a homeopath would talk about this as being what in conventional medicine, epigenetics, we would call it an inherited miasmatic disease, right? Same
Right.
same concept. But now what's interesting and I think kind of vexing, and this is where the PANS part was interesting to me, is because this idea of jumping the vector so that the vector isn't necessary for the sequela to occur and the sequela that are much deeper than had a person, and so the thing that I guess I have multiple questions based on just that premise, right? I mean, we could go on all day with this, but so I have two questions, and you can sort of choose your own adventure. We can hit both of them. One of them, I think about how I'm watching, just like you said, where COVID sort of reignited things, and also watching how different vector-borne illnesses sort of set each other off. So
Yes.
my husband last summer had Lyme. We dealt with his primary Lyme. Everything was fine. And then he got a spider bite. And the spider bite on top of it, he then were, all sorts of things happen. And so we're watching these sort of the multiplicity of inputs that are causing this. But there's this other thing that I can't formulate into a direct question, but it has to do with the relationship between autism or how we watched autism come on the scene. I still remember back in the early 2000s when I first started to see, parents saying, I don't know what to do. I've got this autistic kid, right? And that now seems manageable as compared to, right, what was, and I don't mean to minimize that in any way, shape, or form, but I think the sort of infectious complexity around PANS and PANDAS is sort of asking us to deal with it from from a completely different perspective. I don't know if that makes sense. Can you kind of make sense
Yeah,
of what I just said?
I can try. I
Can you
can
help
try.
me?
Yes, exactly. I
Yeah.
think that one of the big pieces is that we are complex machines.
Yeah.
We are that are living in a very toxic world. And the more processed foods we eat and the more we live indoors in front of screens, the worse that gets. And I think previously our children with autism were our canaries. You
Yes.
know, I grew up in West Virginia. We sent canaries into the coal mines. If the canaries died, that meant it was too toxic for the miners. So back in the day, in the 1990s and the early 2000s, you know, we were seeing the effects in our children with autism.
Yeah.
But now, and particularly I think since COVID, but maybe building for many years before that, we are seeing so many other reasons that our children and adults can get sick, and
Yeah.
so many less healthy people out there that you've got this whether you call it epigenetics or the marasmus or just sick people. We've got
Right.
this not well running machine to start
Yeah.
with in
Like the
more and more
baseline is
people. Yeah.
right. Yeah. The universal baseline has been lowered, hasn't it?
Exactly.
Yeah. Yeah.
And when we talk about it epigenetically, as moms, we're passing on some of that stuff. Our kids are getting not just our genes, but also our germs, and we're not healthy enough. And then we put on top of that that we're trying to survive and working two jobs or, getting takeout or getting the processed food because we can't,
Yeah.
and then the stress of all of that, because as we all know, stress decreases our glutathione, decreases our ability to detoxify. And if there's anything I can say to anybody when you get off this podcast is go out and play in the dirt. Just
I
get
second that.
outside. Don't
Yes.
worry about the ticks you may be exposed to. Do a tick check when you come back. But and to that point also, like to for your husband, it's not just about the ticks. It's
Right.
about the spider bites, the fleas, the mosquitoes, it's everything. And all of these vectors are carrying things that in a genetically or marasmically susceptible individual,
Yeah.
we're going to see problems. And there's more and more of us that fit that category.
Hmm.
Now, going back to your autism for just a minute, I used to see autism and all these other things as overlapping Venn diagrams, but it was
Yeah.
sort of like this.
Yeah.
It's now almost more like this.
Right.
Yes, there are kids that have autism for other reasons, but many of them, it was, you know, dairy that pushed them over the edge. So they may have cerebral folate deficiency, or it was a live virus vaccine that pushed them over the edge, but it was the virus in the vaccine, not the other derivatives
Right.
or it's something else that they couldn't detoxify. Or it was congenital tick-borne diseases. We've got lot of congenital Lyme that is being defined as autism that may actually be congenitally derived infections. So,
I've never heard that. That's quite interesting.
oh yeah,
Yeah.
there's a lot of people that have done a lot of research on that.
Okay.
Babesia, Bartonella, Borrelia,
Hmm.
that can be passed either when a mom doesn't know she had it,
Yeah.
or a mom thought it was fully treated but really wasn't,
Right.
and
Right. Right.
then is passing on through the placenta, that unbeknownst to them. So I think there are more causes out there in weaker bodies that
Yeah.
I'm not saying to make everybody feel worse about things. Oh, I'm just going to give up, throw my hands up. There's nothing I can
Right.
do.
Go get a pizza.
Oh, yeah, exactly. Exactly. Or as a guy I'm mentoring said, I want my pizza and my Diet Coke. And I'm
Right.
like,
Oh. Oh.
it almost offends me so much that I can't even talk to him when I watch him drinking that. But anyway, um, but what I say to parents all the time is do one next thing that you can do.
Yeah.
If your child's drinking a ton of dairy, slowly but surely replace it with non-animal milk.
Yeah.
If your child is eating only processed food, find one fresh food that you can easily get. If your child's in on a screen all the time, find one day a week when you can be outside and those screens aren't there. Whatever it is.
Yeah, I want to hear more about the screen because the screen is, we just had a case in our teaching clinic last night. It's a child with a dual diagnosis of a seizure disorder and PANS. And of course, and the doctors seem to be astute enough to see that it's entirely possible that the seizure disorder is related to the basal ganglia inflammation. And so, but meantime, the parents, and I hear this all the time, they say the screen is the only thing that calms them down. And yet it's also so problematic. How do you, like, first of all, what's the mechanism that is both calming and also problematic? Can you talk a little bit about that?
Absolutely. And Koichi Tanji just gave an excellent lecture on this at medmaps.org. And for any type of clinician at all, I highly recommend the next conference is in September in Philadelphia. But Koichi says it very, very well. And often the screens are not calming, they're distracting.
Mm,
So it's decreasing those intrusive thoughts or it's decreasing that anxiety by distracting them to something else.
okay.
But there's several factors with the screens that make it a negative. The EMF,
Mhm.
which can be helped somewhat by blue screens or blue light glasses, but it's also the addictive properties of screens. The way our video games, our social media is designed is to make it addictive.
Right.
And just like any addict, yeah, you're calmed a little bit when you take that hit, whether
Hmm.
it's Coke, or whatever it may be, alcohol, whatever it may be,
Right.
screens are doing the same thing to your child. And the way you know if they're addicted to it is whether they're on it for 5 minutes or 2 hours. If you give them a limit, can they stop at that time? And if
Right.
they can't, they're addicted. And so it's those qualities of it
Right.
that can exacerbate, particularly tics, anxiety, and seizures,
Okay.
and really get at that part of the brain that is already inflamed.
And so as you're saying that, it's making me think of people who have like a gluten addiction.
Right.
And right, is it affecting the body in a similar way?
Very much so. Because
Yeah.
gluten can also be addictive. It's the way the body absorbs it, takes it
Yeah.
in. And
Yeah.
it's true, think about an alcoholic.
Yeah.
You and I may be able to have a glass of wine, but somebody who really has an addiction,
Yeah.
even that little bit can throw them over. And it may make them feel good in the moment, just like eating some gluten may make a child that has a gluten sensitivity feel good in the moment. But then an hour later or a day later, they're off the edge. So yeah, very, very similar.
One of the things that I've been doing in my research is looking at all of the drugs that are used in autoimmunity. So anytime there are new drugs on the market, then I'll share with the students or in my presentations about look at all the different, whether it's on or off label uses for these drugs, and you see the basic autoimmune profile there, right? And what you were just saying made me think about why naltrexone is probably so effective. So putting kids on a low dose naltrexone regimen, am I right in, because now I'm out of my I'm out of my depth a little bit, but like, is it because of those same receptors, because it has that, for people who have addictions, whether it's alcohol or opioids, is it a similar sort of receptor?
Very interesting you bring up LDN because naltrexone itself, yes,
Yeah.
anti-addiction can be very helpful in that way. But in very, very low doses, even lower than I was doing, it has very good anti-inflammatory properties also. So
Okay.
it's actually working in two ways.
Got it.
And maybe that's why in some children it's even more effective than other anti-inflammatories, immune modulating agents we can use
Okay.
for that reason.
Oh, interesting. That makes sense. What do you consider a low dose these days, especially in the pediatric population? Like under
Like,
50?
oh, under one.
Under one. Oh, like a
Yes. So
microdose.
I was using 5 to 6 milligrams as my low dose and
Okay.
starting maybe at 1 up to 3 and getting up to 5 or 6.
Okay.
Recently, I found several children that I had tried naltrexone on before, but at zero point 0.5 milligrams, they
What?
did better and they never did better at 5 milligrams.
Isn't that
So
interesting?
dosing, and that's the other thing that I love about homeopathy. It's not just about the homeopathic remedy in classical homeopathy. It's also about the dose, right?
Exactly. Yep.
And it may be that you've given too strong a dose or too weak a dose. And the same thing may be true of a lot of things we use in functional or root cause medicine. And LDN is just one of them.
Oh my gosh, I love that. Because one of the things we're seeing in homeopathy, and I guess, it's primarily because the demand is there, so people are shortcutting their training. I'm sure you must see this in the functional medical space. People are like calling themselves a functional medicine expert, right? And we see in homeopathy now people who don't understand the nuances of posology and how important that is. Just like you said, it might not work at one level, but it will at another. And people are doing these combination of all the potencies. And it's a marketing thing, but it just, as you see in whether you're using material doses or whether you're using a homeopathic dose, it's still the dose
Yeah.
is the point. Yeah.
Exactly, exactly. And so I think why so many conventional pediatricians don't understand or believe in this disease is because their visits are 5 to 15 minutes long.
Right.
And I mean, how long are yours?
Yeah,
It takes time
it sure
to
does.
understand all of this and to get all this information from families, whether you do it through questionnaires or you have somebody else on your staff that may be doing it. It takes a lot of information it's not a quick fix. None
Right.
of this is. And that's where I think it's very hard for conventional pediatricians, which are a volume-based business, to really wrap their heads around what we're talking about.
Do you think that the allergists are the ones who are on the forefront of seeing all of this?
They could be if they'd open their eyes, and I don't mean that
Right.
disrespectfully to any
Yeah,
allergist or immunologist.
yeah,
Again, I think in traditional medicine, what we've done is we've fragmented the body. So
right.
we talk about an allergist who's working on allergies and maybe the immune system, but he's really working on allergies, and a gastroenterologist that's working on the gut, and a neurologist that's working on the brain, and an orthopedist that's working on the knee. But all of those different pieces are actually coming from the same root cause.
Yeah.
And nobody's seeing not nobody, but if they're not looking at all of that, they're not seeing the other pieces of it. So an allergist, immunologist, I work with a great one who sees it and can look at the whole picture will
Yeah.
get it. But
Yeah.
he even doesn't really get mold, doesn't ask about mold. And it's only when we work together and I say, look, this mom is not understanding what you're telling her because she's living in mold too. We got to get the mold better before you put the IVIG on.
Yeah. Oh,
Eh,
totally. Yeah,
so
because one of the things, so what you just said, it's in the first lecture that I do in our autoimmune suite in our final semester is talking about how the medical system is not set up to treat autoimmune disease. How many visits it takes to how many doctors, how many years before a person gets a diagnosis, and how each subspecialty is geared on the dead part of its body, the dead part of the body they specialize in. It's like necrology, right? As opposed
yeah.
to this holistic intervention, which then, of course, is going to wind up with problems with the medications, except I guess that a lot of these medications are now crossing over because they are dealing with the immune system, right?
Very true. Like, for example, I just had one of the docs that I mentor message me just this morning. Her child, not her child, but her patient with PANS just got better with being put on Dupixent for their eczema.
Yeah.
And I'm like, yeah, that makes sense. And she's like,
Yeah.
why does that make sense? And I said,
Yep.
because you're still using something to treat one autoimmune disease, eczema,
Yep.
and it's also helping with another autoimmune disease, PANS pandas. So, and I'm not, please, anybody that's listening, don't take that to mean that every child with PANS pandas should be put on Dupixent.
Right.
That's not my choice at all. But it makes sense that there's that cross reactivity, cross pollination
Yep.
you know.
Yeah, this way that the classes of drugs, I mean, my hope is that that's going to lead us to see things through the lens of homeopathy a little bit more, because what happened with homeopathy was when Hahnemann got to between 1816 and 1828, he rethought the entire system
Yeah.
and he landed on this idea of chronic diseases and the root cause of all disease, and he calls it SORA, which is
Yeah.
PSORA. And when you read his literature or his original writings on it, it's exactly like what we're seeing now. I mean, basically, developed SORA is autoimmune disease, and all of the different symptoms that we see remove the causation, but the expression of the symptoms, those are a part and parcel of this core disease, which is why,
Exactly.
right, the homeopaths are just going in at the same level that you are, is looking for what are all the ways in which things are underneath. Now, which leads me to another question. I literally have like 10,000 questions for you, so I'm trying to be like, okay. But so speaking about the allergist, because one of the ways that I'm thinking about this through the lens of homeopathy is around sort of a global dysbiosis. In other words, by the time people are pathological or they are diagnosable in one way, they are clearly showing that they're not in harmony with the external environment, which is why I like your recommendation, just go out in the dirt, right? I used to say to parents of kids I was treating, if they don't eat their body weight in dirt by the time they're 3, they're not going to be healthy.
Exactly.
It's just
We always had the 5-minute rule, not the 5-second rule in our house,
exactly.
you know?
You'll be
It's on the
fine. That
floor,
dog
eat it.
hair. Yeah. So this idea of dysbiosis, it becomes like a global dysbiosis, whether it's can't breathe the air, therefore asthma, contact dermatitis from anything, or migraines from Febreze. No matter how you look at it, right? We are unable to live in this environment that we're in, which is what makes me think about the allergists. And then so looking at all of these sort of dysbiotic ideas, I'm thinking about alpha gal because we're seeing so much more alpha gal syndrome, right? There was just an article in the New York Times yesterday about this, and there was a link in the article to a paper that was written about how if it was ulcerative bowel conditions or inflammatory bowel conditions, probably are probably, or in some cases, just a non-anaphylactic response to alpha gal.
Hmm.
Are you seeing alpha gal? Oh, and for those who are listening who might not know, alpha gal syndrome is an allergy to mammalian protein, which can be found not just in eating, pork, but also in covering coatings of pills or in cosmetics and in immunoglobulins, right?
Right.
So it's like it's all around us. Are you seeing alpha gal or allergies turning up in your PANS and PANDAS patient population?
Absolutely.
Are you? Yeah.
Absolutely. Yeah, definitely. And I think there, you say you have 10,000 questions. I have 10,000 answers. And as you're talking, I'm like, oh, I want to address that. I want to address that. I want to address that.
I
So
love it.
let me just try 1 second because, I trained at Penn for my medical career and Hahnemann is right down the street.
Yeah.
So back in medical school, I read his original paper.
Oh, you.
And all, yeah. And then after we talked last time, I went back to it because
Oh,
it is
cool.
so, like,
Yeah.
I think in some way it was inside of me all
Yeah.
that time from the beginning. And that's why functional medicine so, it resonated with me. The
Yeah.
second thing I wanted to say is one of my favorite autoimmunologists is Yehuda Schoenfeld from Israel. And Yehuda has written a lot of books on autoimmunology, and I highly recommend anything he's written. But he gives a story about when his daughter was having a C-section. It was his job to do the perineal picnic. Now, if anybody doesn't know what that means you take the mother's vaginal mucosa and rub it all over the baby. Now, why the grandfather was in charge of the perineal picnic, I don't know. But anyway, in the emotion of the moment, he didn't do it. And he showed a picture in one of his lectures of his dog Lolly licking all over the brand new baby. And here's to your point of the general dysbiosis. We have more than 30% C-sections, so they're not getting the good germs from mom. We've got moms that are not breastfeeding,
Yeah.
and going to bottle feeding, so they're not getting the good immune and then we've got COVID that's making everybody mask and glove and clean and get rid of every good germ there is.
Right.
And so all of that is increasing, especially in our genetically, epigenetically, whatever way we want to say, susceptible individuals, this dysbiosis. But then to your point about alpha gal, we have even more vector-borne diseases now than we've ever had. I just found
Mhm.
out a few weeks ago we're now up to 60 species of Bartonella. We've got a new form of Babesia in the last several years that goes straight to chronic infection, never have an acute infection, so it's totally getting missed.
That jump the
And
vector kind of
right.
thing.
And
Acute. Yeah.
and then we've got lots of Borrelia, and it's classically Borrelia that then causes alpha gal. But
Right.
to your point, I think there may be, and we're going to learn that there are many, many other dysbiotic germs that cause this inability of the body to respond appropriately and
Right.
therefore see anything as an allergen and not just alpha gal, but the other thing we see a lot of in our kids is mast cell activation.
Just going to ask you about that. Right. Because they're the first responders and they're always on alert now.
Exactly.
Right.
Exactly. And mold and vector-borne
Uh-huh.
diseases are the two things that ramp that up
Yeah.
so much more, but probably many, many other things that do it. And in our chronically dysbiotic children,
Yeah.
that either don't have enough good stuff because they're not playing in the dirt and they're not eating, they're just eating processed food, or have too much bad stuff because of all
Yeah.
the other reasons we're saying. They just don't have the ability to handle the stressors, and that's stressors of any sort: psychological, emotional stress, infectious stress,
Right.
uh, uh, all types of stress.
So if we're talking about mast cell activation, we think of, and I think about some of these drugs that are out there now because of the pediatric population with these, terrifying allergies and being put on something like a Xolair. So if we're going to talk about drugs that span this, right? So Xolair would have that effect on that, on that superficial mast cell response, but also for respiratory issues, a much deeper, asthma and whatnot. So, as a homeopath, I think about sort of the depth of disease and the suppression of the superficial disease, then driving it into a deeper disease. How in the 50 million things we've talked about, do we add that into the picture, that sort of deeper suppressive?
Yeah, I think that in a lot of ways, like with the Dupixent I said, or the Xolair that you're saying, we're actually just suppressing
Yeah,
what needs to be treated at a much deeper level.
right,
And so yes, they may get better, but what I find at least is then it pops up in another way. That autoimmune reactivity,
right.
if we're not getting at the base, we're not getting underneath, it's just going to come back again. And Xolair, Dupexent may be great band-aids,
Yeah.
but they're still band-aids.
It's like you get whack-a-mole. You start
Yes.
with the whack-a-mole. Yeah.
Yeah. Yeah. And so we always go back to, and one of my early mentors together with Sid was Maura McDonald, and she always said, you got to go through a door, not a window.
Yeah.
And going through the door means to me looking at the base of things.
Yeah.
What was going on before the mom got pregnant, during pregnancy, when the baby was first born, in those first few years of life, and then what triggered whatever this is now, and then what's the grass, what's going on in the background, the mold question, the toxicant question, the diet question, all of that.
Mhm.
And if we don't get at those root problems, those nutrient deficiencies, the antioxidant deficiencies, or through homeopathy, the other very basic marasmic deficiencies, so to speak, or
Yeah.
susceptibilities, they're really not going to get better. And I'd
And
rather have a kid, and this is very interesting, and hopefully my son's not listening, but you know, he never believed he ever had PANS pandas. He still doesn't to this day. And
yeah.
part of that is because I raised him to think he can bring himself up by his bootstraps and take care of anything. And I threw homeopathy in, I threw, Hellman therapy in, and I threw all these very bolstering things in, and, never did IVIG or any of these other big ticket items, because with treating the underlying stuff, he got better every time. And
Right.
now he's graduating with his PhD in chemistry. Couldn't be more proud and all that kind of stuff. But
I
and
love
and
it.
a lot of our patients are the same way. When we
Right.
get to the underlying roots of disease,
Yeah.
then we can really get these kids better. But it takes a village. And that's
Yeah.
one of the reasons I love homeopathy is it gets to those root causes, but I also love when we can work together, when
Right.
we can, it's never a one and done approach. It's
No.
always the whole village coming together and changing the diet and changing the root stuff. So.
Well, how do you deal with the diet when you've got a kid that's basically, got RFID, avoidant and restricted food intake? It's like,
And I often don't start there. I may
yeah,
start with one thing, and I always
yeah,
contract with the child, unless I'm talking to a 2 or 3 year old. Then I'm
sure.
contracting just with the parents. But I'm saying, all right, what's one thing I can change? And one of the things is getting protein in the morning. If they're
Hmm.
having our usual standard American diet, sad diet, they're having cereal or pancakes or, a muffin or something like that. I want to get protein in there. And it
Hmm.
may just be adding a protein powder, which is not ideal, but it's something, or a little
Right.
liver
Yeah,
extract,
there's
maybe.
that. Yeah,
So I can do one little thing.
yeah.
Or, I had somebody on my membership who deals with ARFID kids all the time, and she talks about playing with food. Don't get them to eat anything, but, get some bowling pins and roll an apple or a tomato even down the hallway to the
Wow.
bowling pins and play with food.
Yeah,
Make food fun. Build a garden. Have the child cooking with you. Don't have to eat any of it,
yeah.
but get food more into their play. And
Hmm.
and that's a way to do it in these ARFID kids. But no, I'm not like making every ARFID kid gluten and dairy free the moment I see them, because I'll lose them and their parents and everything else. But I start the conversation. I say later when you're feeling better, we
Yeah.
may try to, and the last thing on that is I never remove a food without introducing a good food. So I
Mm.
first want to put things in. I think so much of the time as clinicians, we're talking about, oh, we got to pull this out, we got to pull this out, we got to restrict this. And that becomes overwhelming for these families. If we can
Mm.
add one good thing rather than just taking all the bad stuff away,
Yeah.
then we can inch our way toward better diets.
I love that. We just had a conversation in one of the classes last week about students saying, why aren't we making recommendations on the initial consultation? And I said, people aren't ready yet. And we're
Yeah.
just getting to know them. It's like, know what the tolerance is, know the baseline. And when you were
Yeah.
talking
And
about Diet Coke, one of the cases I'm presenting at this upcoming conference is a client of mine, is an adult with MS, not with PANS PANDAS, but she would bring Diet Coke to my office. And it was, and after, years when she finally made some changes, she said, why didn't you ever say anything to me? I said, because you wouldn't have heard me. I probably
yeah.
did say something, but in one, out the other. Yeah.
Right, exactly. And it's about the relationship. And
Yeah.
that's one thing I think homeopaths have way over, and I only learned about it through the naturopaths who are also trained in homeopathy. And I'd say,
Mhm.
hey, I need you to do a homeopathic consult on this kid. And they would say, whoa, 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 whoa. I can't do that in 15 minutes. Well, you know the kid. No, no, no. I don't know the kid on that kind of deep
Right.
level.
Yeah.
And that's the piece that we miss so much of the time, is that real deep understanding. And in pediatrics, it has to be an understanding of the family. I
Right.
always in my talks have that slide that has the mother and the father, and no judgment on whether it's two moms, two dads, but just
Right.
the parents together with the child, with this halo of an aura around all of them.
Mm,
And if we only treat the child, we're doing that at our own peril,
mhm.
because the whole family unit is what's affecting the child. And if we're not understanding that, we're
Yeah.
also not going to get the child better.
Oh, beautifully put. Beautifully put. Um, Can we talk about just kind of start to wrap it up, thinking about the future of how you see sort of the expansion of understanding around what's happening with these kids and what can we all do to kind of get this message out there in a better way?
It's a great question, and I struggle with it, think about it. My answer changes probably every 6 months.
Yeah.
But right now, I think one of the things we have to do as a society is make things talkable. Whether we're talking politically,
Hmm.
religiously, medically, we all need to be more willing to hear others' point of view
Mm.
and almost more in a Socratic way rather than going about something like I hear all the time on social media. Well, you're wrong. It's not that, it's got to be this.
Right.
Well, no, in this child it could be that, but I want to talk to you and hear about why that is your perspective. So going to a doctor that poo-poos pans pandas, not saying, well, you're wrong and here's all the articles, but why do you have that and maybe not even belief, finding a better word for it. Why do you have that opinion? You
Right.
know, and asking it in more of a sarcastic way so that you're learning, and that may help you with the next person. Okay, the last doctor I talked to said it's their opinion because there's no research. All right, well, they're not going to read 100 articles that I bring them, but maybe I'll get the two best that
Hmm.
that the Look Foundation or Aspire.care, has that maybe, or the other doctor says, because I've never seen any of this stuff work. And maybe then you take them a case, or you take them my book that has 12 case studies in it and shows you, or something else. But really listening to the people that are disbelieving or feeling, thinking differently than you are. Because
Mm.
I think if we don't listen to each other, nothing will change. And that was the other quote that Sid always said, if you listen, they will come. And I think that's
Oh.
one thing that you and I do. And I had a therapist say to me once, it's not your job to fix everybody. Your job is to be present in each of your clients' journeys and be present in the way you can best be present. And it may work for that person or it may not. You're only part of their journey. And I think as clinicians, if we can also take that God complex or whatever else of it is out of
Mhm.
it, that and realize that the person in front of us is the master. Like you said, you may have talked about Diet Coke, but shit, they weren't at a place they could
Not
hear it.
there. Exactly.
So you have your beliefs and I have my beliefs, but we have to meet with the person to get them to hear how right we may be.
Especially where the kids are concerned, right? The canaries
Yeah.
in the coal mine, like we can't not do this. These children are showing us that there's a big problem. And I'm so grateful that you are out there getting the word out and solving these problems for people that didn't have any hope before.
And you too.
Oh, thanks. Thank you so, so much for just for taking the time. I know how busy you are and that you came to talk with us about it. I really appreciate it. Can we do it again?
Yeah, sure. No, not in
I
the
would
next
love
couple of months,
no.
but yes, yes,
Good.
absolutely. And I just wanted to say one more time how much I appreciate and admire homeopathy, and truly all clinicians that are looking at diseases from a root cause perspective, and just know that you are appreciated and loved by at least one, and it only takes one.
Thank you. A pleasure to have you, and I look forward to doing it again.
Absolutely. Thank you.
Got a packed schedule, but still dreaming of becoming a homeopath? AHE's part time professional program brings real time classes, live clinical training, and a full professional curriculum, all 100% online. It's rigorous, it's legit, and yes, it's built for people who have jobs, kids, lives, and a whole lot of ambition. Start your journey to licensure without hitting pause on your life. Visit ahe.online and take the first step.